So this year's flu has been particularly severe. It's a strain that the flu vaccine is not providing sufficient immunization for, which means really that if you've had the flu vaccine, you're still susceptible to getting sick. You may not get as sick, but we've still seen a lot of cases this year. Usually the flu will give you fever, muscle aches, a sore throat, bad nasal congestion, and a bad cough. Yeah, in the last few years, we've had the benefit of a medication called Tamiflu, which is a medicine designed to combat the flu. The problem with the medication is you really have to start it within the first 48 hours for it to be effective. So if you think you have flu symptoms, you should see your doctor or go to an urgent care or a walk-in clinic sometime within the first couple of days so that you can they can screen you and determine if you're a candidate for starting that medication. Flu strain has been particularly severe because of the lack of coverage from the immunization and the different strain that's most prevalent. The CDC has declared it an epidemic for the nation, which means that more people are sick this year, and we've certainly seen that in Tallahassee. We have been just inundated with sick patients having complications from the flu all season long. And our season came early this year, so we started early November, late October, and typically we don't see the peak until about mid-January, so we've been going for a couple of months now. So because of the epidemic this year with the flu and because of the high volumes of patients we've seen, we've had to make some adjustments in the hospital. Specifically, we're trying to get to patients as quickly as possible. There might be a slightly longer wait time in the waiting room. The hospital has been at capacity more often, so bed space is very, very limited, and we've been having to work around all of those problems to try and best serve our patients. If you're around someone who's been sick, then avoiding sharing anything with them like cups, forks, anything that goes in their mouth shouldn't go in anyone else's. Making sure that they're not coughing in your face, good hand hygiene, hand washing, using hand sanitizers. And if you get the flu, you need to stay home. You need to not go to work. You need to not be at school. You shouldn't send your kids with the flu to daycare. Really, the best way to keep it from spreading is by trying to keep people at home while they're contagious, which is the entire time that they have a fever.